Hello, I'm Hannah Donnert with the Collaborative on Health and the Environment. Che enjoys bringing you the latest environmental health science through our partnerships, calls, webinars, science serves, publications, and social media. I would like to welcome everyone to Che's second two webinars in this series, Agents of Change, Amplifying Voices of Future Leaders in Environmental Health and Justice. Our moderator is Karen Wang, Director of Che and founder of Because Health. We will leave time following the presentation for a brief Q&A session. You may type in questions to the Q&A feature available on the menu bar at the top of your window at any point during the presentation. After the presentation, our moderator will read out questions for our speakers to respond to, and we'll also have a discussion with the fellows. We will get to as many comments and questions as we can during the Q&A period. For those of you who called in on the phone, we have posted slides to accompany today's webinar on our website. You can download these by going to healthandenvironment.org. Please scroll to the bottom of the page and select today's webinar. On the webinar page is a link to the slides. Everyone on this webinar right now is muted with the exception of our speakers. This webinar is scheduled to last for 70 minutes and is being recorded for our call and webinar archive. With that, I'll pass this off to you, Karen.
Great, thanks so much, Hannah. At Che, we are committed to increased diversity in environmental health and amplifying scientists of color and other underrepresented backgrounds. That is why we are so excited to have the second webinar on Agents of Change, which is an ongoing series featuring the stories, analyses, and perspectives of next generation environmental health leaders who come from historically underrepresented backgrounds. The George Washington University Milken Institute School of Public Health has partnered with Environmental Health News to provide this space for the environmental health leaders of tomorrow to explore the intersection of research, health, diversity, and justice. If you missed the first webinar in the Agents of Change series featuring 4 of the other fellows from this year, you can find the video recording on Che's website. During this webinar, Dr. Zota, the founder and director of Agents of Change, will facilitate a Q&A discussion with 4 of the fellows. Dr. Zota is an associate professor in the Department of Environmental and Occupational Health at the George Washington University Milken School of Public Health. We are so happy to have her back with us today. I'm going to briefly introduce the 4 fellows who are speaking today, but you'll hear much more about them soon. We have El'gin Avila, who is a PhD student studying industrial hygiene at the University of Minnesota and the founder of Equitable Health Solutions. We have Dzung Chu, who is a first-generation Vietnamese immigrant, Gates Millennium Scholar, and PhD candidate at the Harvard T.H. Chan School of Public Health, researching housing and environmental health disparities among low-income and immigrant households. We have Dr. Ans Irfan, who is a doctor of public health student and an adjunct professor at the Milken Institute School of Public Health, George Washington University. He is also a health policy research scholar with the Robert Wood Johnson Foundation. And lastly, we have Brenda Trejo. She is a PhD student in the Environmental and Occupational Health Department at the George Washington University Milken Institute School of Public Health. So I'll turn it over to Dr. Zota, who will tell you more about Agents of Change, and get ready for a discussion. Thank you.
Good afternoon, everyone, or good morning for those of you on the West Coast. I want to thank Karen and Hannah and all of Che for welcoming us back. We really enjoyed the first part of the conversation that we had this summer and are looking forward to continuing it. I'm going to try to make my comments brief because really I want to give the digital megaphone and the attention to the fellows to share their views, their research, and their thoughts. But just to kind of contextualize our conversation, I'm going to share a little bit about the program and why I started it. So as Karen mentioned, I'm the founder and director of Agents of Change Environmental Health, and my day job is I'm an associate professor of environmental health at the GW School of Public Health. Okay, let's just make sure that I am, okay. So, oh, 1 second, there, okay. So my work broadly seeks to secure environmental justice and improve health equity through advancements in science, policy, clinical practice, and communication. And, you know, often previously I would come to Che to talk about my science, but today I'm really going to talk about those innovations in communication. Just a little bit about my research. I'm increasingly thinking about how social structural processes shape the environmental exposome and related health disparities. But the way I really like to think about it is everything I do, I try to maximize impact. And often that comes through disruptive innovation, because really sometimes you have to shake things up to really make an impact. My journey with science communication actually started over 10 years ago. Hard to believe. Back when I was a postdoc, I think a lot of us, pursue public health, a PhD in public health, because we want to do good science that leads to policy change, and we kind of naively come in thinking that, if you do good science, you publish a high impact paper, change will happen. Well, lo and behold, it doesn't work that way. And the longer I stayed in this field, the more I realized the path between good science and policy change always involves science communication. So I've been doing a lot of it, starting off by translating papers to the media, answering questions. And then as I stuck around a while in this field, I became more of just a go-to expert for reporters. And I've dabbled in writing commentaries and op-eds. And, what I've realized, and this has even gotten a lot of tension in the time of COVID, right? So we've been very reliant on our key experts, our scientists, our clinicians, to translate information about COVID to the rest of us. And they're kind of our gatekeepers of information. Well, often, even in the example with COVID, and as well as in environmental health, these thought leaders in science communication, really those that are kind of seen as the experts in the eyes of the public, are predominantly senior white men. And this has impacts of also what information and perspectives and voices get amplified. So last year I went on a sabbatical. Hallelujah to sabbaticals. I recommend them for everybody. And I just had a chance to kind of exhale, take a deep breath, and think deeply about the changes that I wanted to help make moving forward. And I realized that one of the things I wanted to try to do was amplify neglected voices in environmental health and help foster a new generation of more diverse and inclusive thought leaders. And here I'm thinking broadly about thought leaders. This is both lead thought leadership within the academy, but also outside of the academy, because I think we really need to restore that relationship between scientists and the public. So I had this big idea. I love thinking, on the implementation side, I always need help. And back in the time when we could go to conferences, I had, Pete Myers and I, the founder of Environmental Health News, we were at this alternative medicine. We were both speaking at an alternative medicine conference in Flagstaff, Arizona. And I mentioned this idea and his eyes just lit up. And he said, we would love to partner with you on that. And he introduced me to Douglas Fisher and Brian Biakowski. And this amazing partnership was formed. So this really wouldn't work without EHN, Environmental Health News's journalism, media, expertise. Brian Biakowski has, he is my thought partner in this. So he's a senior editor at Environmental Health News, and he's become the editor of Agents in Change in Environmental Health. And so all of our essays are originally published on their website, both in English and in Spanish. So what are we trying to achieve with this? And this is kind of a work in progress, and because as I say, we're kind of building the car as we drive it. One, we're trying to increase the impact of the, early career scientists from underrepresented backgrounds. So we're training them in next generation science communication skills. We're giving them a platform to test their ideas. A diverse cohort of colleagues in similar fields, and a digital megaphone. We're trying to inject new ideas into the environmental health science and advocacy communities, because I don't think business as usual is going to cut it with the kind of problems we're facing today. And we need bold, innovative ideas to push our planet in a healthy, more just direction. And representation matters. Environmental health is a predominantly white field. to increase diversity and inclusion in the field, we need to broaden our perspectives and center non-white voices. And I think this will also have the impact of bringing more diversity into the pipeline of environmental health. And I started this program, started thinking about it last summer, and this was before our current syndemic, right? And so just the kind of overlapping catastrophes of COVID-19, climate change, racial injustice, and economic collapse from the pandemic have all just converged in just this very stark way. And I think this has just really reinforced the need of new leadership to handle, this syndemic that's not going away. And so that's kind of how I see the role of agents of change. So what did we do? So this was a pilot year. And we recruited 8 early career scientists from backgrounds historically underrepresented in science and academia. And, I just want to kind of give a special shout out to these 8 fellows, because it was really me calling them and just asking them to take a chance on this idea that I had. They were doctoral students, postdocs, and research staff. And we had folks from 5 different institutions. Most were in environmental health. We did have 1 fellow from ecology. And so this is just the 4 that will be speaking today. So Ans Irfan, and this is a picture and title of the essay or blog that they wrote as part of this program. And so hopefully, we're gonna kind of dig deeper. So he wrote about farm workers' rights and kind of global discrimination, kind of global oppression against farm workers' rights, and kind of weaving his experience between his home country of Pakistan and the US context. We had El'gin Avila, and he wrote about urban gentrification and urban displacement, and really how these need to be framed as critical public health issues, and really kind of both also drew on kind of just his personal experience of watching a lot of this change while he was in DC. Dzung Chu wrote about housing security as key to environmental justice, and wrote beautifully about kind of both her science and community organizing in her very diverse neighborhood of Dorchester in Boston, Massachusetts. And Brenda Trejo, who just published hers, I believe last month, or was it this month? It's all blending together these days. And wrote about both her experience of being Chicana in the environmental health field, and how, kind of a call to action for the public health research community and their need to kind of explicitly grapple with racism. Just a little bit about numbers. We all like numbers. Since January, we've published 10 essay blogs in this series. The total views, and I don't even think this number is quite up to date. We're approaching 1 million views, and those are just the ones we track through Environmental Health News. Some of these are being reposted, republished on different sites. I just want to call your attention to over 100,000 of those views are in Spanish, so there is a demand here. Median and max. So we're getting the content out there, and we're on to something, and people are excited. So we're growing the program. So when I was here with the first round of fellows, I believe in July, we had a call for applications to do this again. And in 6 weeks, we got 83 candidates. Amazing, amazing, amazing early career scientists. After a lot of very difficult decisions, we have actually decided to grow our program. We've selected 25 new fellows, and we're going to divide them into a fall cohort starting early next month, and then a spring cohort. These are, there's a lot of diversity with respect to social identities. And this time we're also opening it up to a broader group in terms of research disciplines. So we're moving out of just environmental health to, environmental chemistry, some medical students, sociology. So it's really, really exciting. If you want to keep tabs, we've started a monthly newsletter. You can go to our website and sign up for it. And we're also going to be starting a podcast a little bit later this fall. So with that, I'm going to stop sharing my screen. And okay, and I don't know if there's anything else we need to do in terms of Hannah. You can tell me if we're ready.
Everything looks good. Yeah, I think we've got everybody on.
Okay.
Yeah.
Okay. So, so I'm going to just start by both asking you all to kind of describe where you are right now with your work, your research, what you're working on, and maybe, you know, if there's anything else that was missing in the introduction of how we introduced you, how you would like to introduce yourself. So I'll start with Ans, and then maybe we can go to Dzung after that.
Hello, good afternoon or good morning. I am finishing up my DRPH. I will hopefully be writing my 4th proposal and sending it to my very generous advisor. He has been very kind to me, but most of my work these days is focusing on, depending on the day, occupational health, mostly farm workers, and the intersection of climate change. And another particular thematic area is religion and public health, specifically as it relates to climate misinformation. Yeah, so, but the common thread there really is health equity and translation of existing research into policies and programs.
Dzung.
Hi everyone, my name is Dzung. Really an honor and privilege to be here and with my amazing colleagues in AOC and Dr. Zota. So my research now, I'm a postdoctoral research fellow at George Washington University at the Milken Institute School of Public Health, working with Dr. Ami Zota on this important HUD-funded grant project with also collaborators at Harvard and Penn State. We're looking at the impact of affordable housing policies such as public housing, housing choice voucher programs, and income restricted units, and its impact on residential environmental exposures such as lead, secondhand smoke, cadmium. And this really relates to my dissertation research, which I successfully defended last month or 3 weeks ago at the Harvard School of Public Health, and which really looks at environmental health disparities and the intersections of race, ethnicity, socioeconomic indicators, but also immigrant status. And thinking about contextual factors such as home ownership or housing assistance programs to housing cost burden to just residents in immigrant enclaves, and how does that modify exposures and opportunities for intervention. So again, I'm really happy to be here. I'm in Boston and Dorchester, like Ami mentioned, and thanks for having me.
El'gin?
All right. Currently I'm working on my dissertation as well. I'm a PhD student over at the University of Minnesota. And pretty much the work that I focus on is related to the interaction between, or the impact of COVID on gig workers. So ultimately what I'm trying to look at and kind of assess the impact of precariousness and the gig worker work environment and the impact the pandemic has had on both the physical and mental well-being of honestly such a very diverse workforce that is vastly understudied and not well understood. So soon I'd like to kind of work a little bit more and kind of prioritize Black and brown women in the workplace because I feel as though they're in many ways like one of the most understudied but also less understood kind of workforce and in society. So I think ultimately I'll be kind of shifting towards that and kind of taking a justice-based approach when it comes to my research down the line. And hopefully I can find a way to kind of tie it into my dissertation. But if not, I'll be working on programs and I also do some consulting. So hopefully I can kind of address that as well.
Thank you. Brenda?
Hi, everybody. Good morning. Good afternoon. Good evening, maybe. I don't know. Hi, welcome. I'm Brenda Trejo, and I'm a doctoral student at GW's EOH department, Environmental and Occupational Health. And the research that I'm focusing on currently is with the healthcare workers, COVID-19 healthcare workers survey, led by Dr. David Michaels, Dr. Melissa Perry, and Dean Goldman at GW School of Public Health, where it's a mixed method survey, and we have collected data from healthcare workers to investigate the occupational exposures and how to prevent COVID-19 exposures. So that's also related to, in terms of highlighting the voices of participants, to some work that I worked on as a master's student and also as a doctoral student for Dr. Zota, which is the fibroids observational research on the genes and the environment. Okay, so Forge is, trying to investigate the etiology of uterine fibroids, and also looking at the disparity of uterine fibroids amongst, between white women and women of color, because women of color have more uterine fibroids, and they're more severe, the symptoms, and even larger too, the uterine fibroids themselves. And they're very painful. And so it's something that isn't always focused on. And I think it's really cool, and it kind of like highlights what I'm very much interested in terms of intersectionality and environmental health, because we're looking at environmental exposures. How does that impact not only women's health, but also looking at other factors like race, and which is highlighted in Dr. Zota's awesome commentary on the environmental injustice of the beauty industry. So yeah, that's me. I like to focus on health equity and expanding what we look at. And I'm really excited to be here. So thank you.
Thank you, Brenda. And I'm going to come back to this kind of at the theme of intersectionality, which I think is something that a couple of you touched on in different ways, and I know it's very important to a lot of you. But before we get there, can you, so the next topic I kind of want to talk about is kind of what the experience was like, kind of engaging in this type of writing, essay, blog, personal, kind of from a personal perspective, writing for the kind of a broader audience than a scientific audience, and kind of what that process was like, both working, in the workshops and then like after you published. So I'm going to start with El'gin.
You sure you want to start with me?
Yeah.
No, if you don't mind, just go ahead and repeat the question so that way I can make sure I got it.
Just a little bit about maybe just talk about like what the process was like actually trying to do this kind of different kind of writing. Mm-hmm. And then what it was, so like talk about that, and then also, or you could just talk about what it felt like, what the experience was like once it was published, and maybe if you want to share any of the feedback you got or anything like that.
Okay, yeah, absolutely. So I think this writing was honestly kind of, it was really insightful, but also it was a little bit energizing in a lot of ways. It was really nice getting a lot of feedback from like folks who are like me and who also experience different things, but despite them coming from different communities, and honestly having great mentorship in that regard. And I don't say that lightly. If Ami wasn't here, I would still say it. Truthfully, it was a very unique experience, and not a lot of people are, fortunate enough to be in this kind of position. So I really was able to appreciate that. As far as like any of the feedback from it, truthfully, I didn't receive much negative feedback at all from my writing, which kind of makes me feel. You said what?
What about positive feedback?
Yeah, so I received plenty of positive feedback, which was great. But I ultimately wanted to get some of that negative feedback because I thought I kind of either wrote like this phenomenal piece that nobody really disagreed with, or two, my piece was like not provocative enough, and in the sense that it wasn't thought provoking, or it didn't kind of elicit like some kind of desire to kind of like fight against some kind of status quo. So I felt like that was where I kind of like didn't do as well as I would like, but a lot of people were very encouraging from that process, and like from me writing this. A lot of people were, I would say they were very supportive in the sense they were like, hey, we can see that you could do fantastic writing, and we really appreciate that. We would love to see you kind of tie that into some of your science communication a little bit more, especially since I do industrial hygiene based work, which most people don't know what that is. And in general, it focuses on occupational health, but like there's still more aspects to it that most people aren't well aware of. So they encouraged me to kind of find a way to tie that into there, find a way to tie it into occupational health as a whole, and kind of be one of those agents of change when it comes to science communication, especially from the public health and occupational health sector, and try and change the relationship between the public and the private sector, and as well as government, and so on and so forth. So ultimately, that's kind of like the feedback that I got from it. Again, I was well encouraged from it. And even the things that I didn't necessarily get from it, this experience, I don't think I would have been able to kind of identify those things that I wanted to experience both in my career and both to enhance my writing down the line. So definitely a great experience.
Ans, do you want to kind of chime in both about kind of the feedback you got and what the process of kind of working on this type of writing and, you know, some of those themes?
Sure. So I guess for me personally, like, and to y'all, it's probably going to sound like a broken record because I've mentioned this before. I am a somewhat recent migrant to the US. Like I moved here in 2013. And at that point, I barely spoke English, let alone be able to write it in a language that, you know, at least locally US folks would understand because of the sort of like distinction, how we write in the US versus elsewhere. And the other thing also is that I've been working in practice for more or less like 10 years now, and no one has time to sit there and write a journal article and go through intellectual narcissism of some reviewer to publish it for 7 people to read. So that's something that it's not a practice related thing, it's a very academic thing. So this was really a nice midway point for me, that if you have certain ideas, you're able to sort of like convey those and share those with the rest of the world. So for me, it was really a great spark that a lot of the rants that I would do otherwise with my friends, El'gin and Brenda are often victims of those. Now I'm able to put those on pieces of paper and share it with the world. So it was great. Like, and it was just, I had a phenomenal experience, and I just needed those training wheels, if you will. And this is something that I don't have psychological barriers that I do against academic writing often. So I'm like very happy about that process. And as far as the feedback is concerned, there was a lot of positive feedback, like, you know, you yourself shared and we've talked about, but then there was sort of like, you know, a lot of pushback on that basically don't question the status quo. It was really about the don't involve, because people perceive it as political activism. And in my view, that's sort of like, and that's a fallacy in itself, that we need to stop pretending that public health is apolitical. We are not. We are not partisan, but we are inherently political. And that's something I think like people need to have those debates and conversations and think about what are those frameworks that where we can ethically maintain the methodological rigor, but also be able to acknowledge that public health is inherently a political field, and just stop pretending otherwise. So in that, I think like, it was great, like, you know, having those conversations back and forth. So yeah, it was just such a phenomenal experience.
And then can you, because you've been doing quite a bit of writing in the public sphere, can you tell everyone just very briefly about your recent shared op-ed or co-authored op-ed?
Sure. The most recent one we just published, and again, that was thanks to the training wheels of this particular program in Boston Globe. It was really talking about this sort of like, you know, structural issue where we keep uplifting MDs to run public health response, and we keep pretending as though they know what they're talking about. And I'm a trained physician, and there's virtually nothing in clinical medicine curriculum that would prepare you to run a public health response. So this thing really sort of like, you know, and it got a lot of traction, and we got almost all of it was positive feedback. Some of it was negative from my MD colleagues who were like, you know, you're the black sheep. So, but yeah, it was great. So I think like next time when you share your slides, you should put all the ensuing op-eds people have written.
Yeah, we're working on that. We're working on that. Yes.
As your impact.
You know, the team to keep up with all of the activity of all of you and kind of, you know, keep track of how the blogs are doing. Yes, the team is growing to keep up with that. So,
yeah, great.
So Brenda, can you kind of comment on what it was like? I know you were kind of had some, you know, you were kind of testing some ideas and you weren't sure how they were going to be received when they published. And so can you kind of share what that experience was like?
Yeah, of course. So I think the whole AOC experience, or Agents of Change experience, was really helpful because when we started, you know, I was trying to figure out what topic to write about, because I did want to talk about how like public health itself is complicit in sustaining health inequity. And I feel like until working with Agents of Change, and then until working Agents of Change with this program, I was able to like explore that and get feedback from my colleagues and understand that, okay, it wasn't like, there are policies within public health and there are practices within public health that researchers sustain, you know, that ensure that communities of color, lower income communities, marginalized, oppressed communities do not have access to the best, you know, well-being that they could have. And so for me, it was very frustrating because I would try to like bring this up in my classes sometimes, and especially like environmental health. And it was never really at the forefront of those conversations. I think like my experience was unique in my master's program with my cohort that included Ans and El'gin, and we were, and then there were more folks, and we were a pretty diverse cohort. And I think that helped us explore a lot of issues that we don't usually explore in public health. Like talking about intersectionality, asking like, why are these methods this way or that way? And so I tried a whole bunch of different ways to address that. And then with 2020, looking at the COVID-19 pandemic, and also, you know, the Black Lives Matter movement, and highlighting just all the inequity in this country, in the USA, all of a sudden people were like, okay, let's talk about racism. Let's talk about how it's a problem in the world and how it's a problem in public health. You know, it's like, okay, everybody wants to talk about it now, which I'm super excited about. But I think it was very frustrating to feel like you're being gaslighted when you know the experiences of marginalized communities, because you're from those communities, you know, and other people telling you like, this isn't an issue. So I think for me that that was very helpful, you know, having our cohort and seeing that I wasn't the only one struggling with public health, and public health not wanting to be reflective about its practices. And in terms of responses, you know, we just published my blog a little bit ago, but I've had a lot of students, you know, from, you know, all over the world actually like reach out to me and tell me, you know, like, thank you so much. I felt really heard with your blog, you know, and also I want to learn more about environmental health, you know, because there's these issues happening in my community, or like I feel really seen with your blog. And so to me, that's just like amazing, you know, because I think before the Agents of Change, I felt like maybe I was like really alone. But it turns out that I'm not. And I think that's why the program has been pretty successful too.
Thank you. Mizang?
Okay, I'll add a few other points, really echoing my other colleagues. I think two things I wanted to make is the coming off of the topic is really difficult. I think Dr. Zota selected people, and we came in not necessarily having our topics already lined up or our research really clear cut. And so the process of writing was really helpful for me to understand. I was in my 4th year, and I was doing a lot of community organizing with Dorchester Not for Sale and other housing justice groups in Dorchester. And then going to school, doing research on my dissertation on indoor air quality and housing conditions. And I found that these worlds were so disparate in my own life, and frustrated that, the few experiences that I've had to go through. For example, at school, I was part of a community engagement meeting where faculty was sitting around and kind of asking, like, what does the community want? What does the community need? As an environmental health department, what should we do? And just feeling a sense of frustration that these questions, glad that they're asked, but that they're that we don't have answers yet. And also another experience in which I applied for a prestigious environmental health leadership fellowship, and I talked about my leadership in the community on housing stability and fighting for affordability. And unfortunately, I didn't get that fellowship. And I think that one of the points that they said why was that I didn't communicate my research and my leadership as well as the other candidates. So I think that kind of was a turning point in my education, to say I need to better communicate what I do, but also merge these two worlds of community, like what I love, right, in the community, my passion of doing community organizing with my research and really being present in that voice. And so I think the blog and the editorial writing forced me to be front and center, to say, like, hey, this is what I think, these are my opinions. And my fellows, the other fellows, really helped me with that. My first draft was super technical about housing security and why we need it, and listed a lot of facts. And I think the first feedback I received was that we're missing your voice in this. We want to hear from you. We want to hear from residents that you work with or engage with in the community. Where's the human voice to this? And I think that was probably one of the first time I've been asked to state my opinion, right? Because I think in scientific writing, usually its objectivity is always prioritized, and you have to include references, and you have to kind of state your authenticity on the subject matter. And maybe that's some of my sense of imposter syndrome coming out, right? I need to assert that I know a lot about this topic for the readers to believe me. But I think that this process, and with Brian on me just kind of helping to dissect the writing and to say, you can't use jargons. If you put environmental justice, what does that mean? What does housing security mean? And just to put everything in a very lay terms helped me to clarify my own voice. And I think that really helped me. And because I did this over my 4th year, it really segued to thinking about career opportunities after I graduated, and what did I want to do. And I think it made me realize that I really cared about continuing to work in the community, doing more housing policy, EJ related research. And so fast forward to what happened afterwards, I think I was really nervous publishing the blog, because there's some points where I did criticize traditional environmental health research as not kind of addressing the roots of why people can't access housing and quality housing. I did run it through a few people to make sure there was no red flags, but overall really positive feedback. I think one thing, my family reached out from different in-laws and distant relatives reached out to say hey, I didn't realize you're in this work. I'm really I'm glad you're doing this. And I'm also noticing this in my own community or in past work that I've done. So it's really great. It generated a lot of conversation within my family. A few students reached out to me to say hey, I never thought about housing security and homelessness as an environmental justice problem. And that's something that they want to pursue in their project or thesis work. So it was really uplifting for me And then a few folks from academia reached out to me privately and to say like, hey, I'm really glad you're doing social justice work. It's glad to know that, you know, people in academia also are doing this. So that felt very validating. But, you know, as you know, this is one blog, right? And there's so many people in this field doing so much of this work. And it's only like the beginning of my journey to understand like all the experts in the field already. But I'm glad that like this is opportunity for me to like enter that space, but also recognize my own voice in that space. So that's all.
Super powerful words from all of you. Thank you so much. And one thing, Mizung, that you said that I think I heard from quite a few of you, that, you know, this was it was very accessible to your family members, and also, you know, having it in Spanish, some of you have Spanish speaking families, and that it was really the first time, quite a few of you said that you felt like your kind of familial community actually had a real glimpse into what your, you know, what you do day to day and what you care about. And so I think that's just another kind of neat side effect of this. So I'm going to switch gears a little bit. So a lot of you have like implicitly, explicitly mentioned intersectionality. You know, I'm going to kind of throw out one kind of guiding principle definition of it, but then I want you to kind of, you know, you can kind of go anywhere you want with this. Like you could either talk about how, like why you think it's important to environmental health, how you're actively integrating it into your research or practice, or you can also give, you know, what do you know, so on these calls, it's, you know, scientists, it's advocates, it's regulators. What do you want them to know about intersectionality? You know, because this isn't like a theory that we're taught typically in environmental health. So, you know, at least as I understand it, you know, the idea of intersectionality is kind of overlapping systems of oppression have a profound impact on the lives of people that are marginalized by inequity, and that, you know, these overlapping systems of oppression are not additive. So, you know, the term was first coined by Kimberly Crenshaw as she was talking about the experiences of Black women, and, you know, explicitly made the point that, you know, Black women experience sexism and racism, and you can't just look at one in isolation. There's a synergistic effect, and so it, you know, they've continued to expand on that idea, but it's, you know, kind of this idea of how macro, you know, systems of oppression at the macro level can affect, you know, an individual. I'll just kind of start the conversation there, but I'd love to hear your thoughts on this, and I'll just open up the floor. Mizung, do you want to get started?
Mizung, do you want to?
Go ahead, Brenda.
Okay, I can start.
You wrote about this in your blog, so I'd love for you to go first.
I'll start because I feel like maybe I'll just go, whatever. Yeah, nobody's going, so I'll go. So I think that's really important that you brought that up, Dr. Zota. I think one, it also highlights the importance of transdisciplinary research, you know, so incorporating the social sciences, also more value of qualitative data in our public health research. And I think one of the things that is very important in intersectionality, and having the platform with hopefully, you know, like the folks attending this webinar are in positions where they can influence different public health policy or interventions. I think it would be very important to recognize that intersectionality, also folks need to understand their own positionality, you know, and you need to be self-reflective, you know, so that means everybody, you know, like, let's say I'm a researcher, you know, or I'm a researcher, or yeah, like let's say there's a person, they're a researcher, they're making decisions about grants and who they're gonna fund, you know, like what is their position about something? Why do they think something is important and something else isn't? Or how does a researcher in their position, you know, looking at race, class, sexuality, how does that influence your engagement with your research participants, and then your even like your research team also? So, and I think a lot of folks don't want to realize that, or don't want to identify as an oppressor, but I think like all of us, unfortunately, you know, have different levels. Well, we have different levels of privilege, and we can be oppressors at one point or another. So it's like really looking at your positionality and being self-reflective about that, and then using the privileges that you may have to make sure that you're advancing health equity. You know, like for example, myself, like you might not think that I have a lot of privilege, you know, but I know that in my community, you know, I can speak English and I can speak Spanish. So that gives me a huge access to a lot of things in this country. Or, you know, like my citizenship status, I am documented, and for other folks that might not be the case, you know? So we all have varying privileges, you know, and I think like it's okay to address them and work with them, you know? And so like if you have white privilege or class privilege, like you got to do the work.
Those are really great tips, I think, and recommendations. So thank you, Brenda. Anyone want to build off of that?
I could just talk briefly, thinking about, I think the methodology for intersectionality, at least in public health research or epi research, is still behind. I think we need more methods to be able to understand and analyze appropriately intersectionality. I know that like Greta Bauer have published some papers on this, but in my dissertation work, I wanted to think about how does residential environmental exposures vary? How do we think about immigrant status as another social position that's important in addition to race, ethnicity, and socioeconomic factors? So I think in doing that and accounting for this group that's generally not included in thinking about health disparities literature, I was able to like illuminate, right, that I found that on average, immigrants are known to have better health status, chronic conditions. But if you break it down by income, if you break it down by language access, break it down by period of migration, there's so much variability. But you also, if you intersect that with race, ethnicity, and poverty, you see that like, as far as housing quality, we found that based on the American Housing Survey, Black US born families had worse housing conditions on average than Black immigrant families after controlling for FCS and many other sociodemographic factors. So I think like accounting for many of these social positions allow us to identify like what makes it that we still see this excess disparity. And so I talk about in my discussion of like I wasn't able to account for structural racism, right? Intergenerational practices like redlining that have really driven residential segregation that impacts housing outcomes. But I think also in addition to that, there's other factors like migration policies that really determine which groups get to come to the US. So there's been quotas in the past like hundreds of years that preferentially picked like white immigrants, immigrants from Northern Europe, immigrants that were more skilled workers, higher education. And so that really influences who comes here. And I think when we do, just my personal opinion, when we do intersectionality research, we're able to really understand these like institutional systemic factors that drive the differences we see in health outcomes and housing outcomes at the individual level. It really tries to deter us from thinking about like innate biological or behavioral differences. and really think about like what are shared factors that if you're person of color, a limited English speaker, low poverty, and also immigrant, you're also susceptible to these environmental exposures, as well as US born and also person of color, limited SES. So it helps us to kind of guide our intervention and be a better public health practitioner, I think, using the lens of intersectionality.
Really well said. As was, I think thinking about how it informs kind of causal processes of structural inequity, but also, I've also appreciated your call for more, we need different and advanced methods as well. Ans or El'gin?
I think they covered it. If I talked about it, I'm going to sound like that man who repeats a woman's words and take credit for it. But I guess I'll just add one thing that sort of like, people do need to realize, researchers, doctoral students, but particularly faculty and folks in senior leadership for all these nonprofits and so on. One of the things is academia teaches you conformity and obedience and nothing more. It tells you that we are here to clone you and nothing outside of that particular thing. So building off of what Mizong was saying, like more methods in terms of like, methodological advancement as far as intersectionality is concerned, that part. But the other thing I would want to highlight is that I think we need to learn a little bit humility in academia, that if you have a PhD, which I'm pretty sure a lot of the people who have signed up for this webinar do, you belong to 2-3% of this population, right? So you cannot tell me you got through all that mess and you cannot learn more about intersectionality or any of these things that you consider complicated all of a sudden, right? So so that is all to say that focus on that humility aspect, but also on learning. I think that's one of the things that academia doesn't encourage us to do enough. We're taught a certain way of doing things, like, Mizong brought up race earlier, right? Like, race is just a proxy for racism, like we control it and we move along, and nobody discusses that in a really meaningful way, that why is that, the causality of it all. We just throw that race variable in a regression and we think that we've done the job of fixing structural racism. And that's something, and within that too, like, a lot of time that race that people mark on those forms, I write myself as an Asian anytime I'm writing those forms, and that's not going to capture that experience, because like, folks who moved here or cultural backgrounds from China is going to have a different experience, from Vietnam different, Cambodia different, and so on. Then they all tick that Asian, right? So that's a data quality issue. And we don't acknowledge a lot of those issues, that how we need more disaggregation of data, better quality of data, and more importantly, going back to that unlearning point, thinking about how can we sort of like, get over all that we've been told that this is the only definition and boundaries that you can work within. No, we can do better. So.
Okay, thank you. El'gin?
I like to keep my comments brief. I feel like my colleagues did a good job, so I'm gonna be quiet and I'll let us move on to the next question.
Okay, so I think we're at that point where Hannah and Karen, are there questions from the audience or questions that Karen wants to ask?
Sure, we have a couple of questions, but if you have a question in the audience and you haven't typed it in yet, please type it into the Q&A box and we will answer them. We had a couple sent over. Well, one asked about how we can find out more about your research and what you're going to be doing. All of your Twitter handles are on the webinar page, and I think that at the website, Ami, you can find out more about the work that these fellows are doing, right?
Yeah, we do have brief bios. We also have links to their LinkedIn sites, which maybe is also another venue. Does anyone else want to chime in about other ways, people can stay up to date with what you're doing, or how you like to kind of share what you're doing with the world? Brenda?
Oh yeah, I have a suggestion. Well, I shared the website, the Agents of Change website that is really good, that Dr. Zota and her team put together. I would say, in this time where, you know, social media, Twitter, LinkedIn, folks are making or communicate a lot that way, you know, and people get like a lot of followers and stuff. So what I would suggest is, if you want to follow us, you can follow us. But I think when you are following somebody who is seen as a public health expert, like question, you know, like who are their followers and why do these people have such followers? Because I think just like there's other movements like, you know, the Grammy's so white, Oscar's so white. I think that public health and environmental health is very white also. And so it's going to be people that usually have this privilege, you know, heteronormative white men and females that are given the mic to speak on about issues while other voices are marginalized. So I think I also want to thank Dr. Zota for, you know, sharing her platform and allowing us to like share what we think, because I think many of us with this, we were like, we want to write about everything. There's so many things we want to write about because we've never really been given the opportunity to share our voices, you know. But luckily, I think like it's realizing, okay, like I don't have to cover everything in this blog. I'm going to cover something, and this is a start, you know. Like I don't think other people have taken the time to reach out to underrepresented students, let them share their voice and be like, this is just the start, you know, like you got a lot of ideas. You don't have to share everything right now. So yeah, I would definitely like support following at least my cohort members' Twitter accounts. If you don't follow mine, that's fine.
Okay, great. Maybe all of you guys can just chat it into the chat box, your Twitter handle. We had a question, what encounters with racism or other forms of oppression have you dealt with within your current research, and how have you navigated it? That's a really big question, but if you could address a little bit of that, anybody?
I guess I can go ahead and kind of start this whole process. I think
it's a lot. Yeah.
Oddly enough, I've been like quite fortunate, you know, due to my, I guess I would say like I'm a pretty like imposing person since I'm 6'2" and I look like a football player. So oftentimes people approach me with that kind of guise when they talk to me. So it's a lot less hostile, but that still to a degree is an issue in itself. So people approach me as like, oh, you play ball. Oh, you do X, Y, and Z. And they don't think that necessarily I'm capable or I have the ability to kind of produce the research that I do, or to, you know, actually consult with various safety professionals and companies and organizations and things like that. So a lot of those things are inherently an issue, but oftentimes they're very passive in nature. So some of the ways that I kind of try and navigate those spaces, I typically try to, again, not necessarily impose my will in those kind of cases, but I do encourage and try to find subtle ways to plant the seeds that, you know, people who look like me are far capable of, you know, a lot of things that, you know, I would say we're not publicized to necessarily be talented in. I think one of those things is I also struggle too when it comes to the whole process of not only acknowledging my ability to kind of code switch, but also to write in a very accessible way, but also to try and learn how to do academia. And I often have those struggles with folks who are so ingrained in a very traditional academic kind of mindset that when they suggest things and I try and challenge those, they really combat me and they say, no, this is absolutely what it's supposed to be. And there is no diving between it. I've done this for 30 years. How dare you, a 25-year-old PhD student, try and argue with me? Like, and I've only done this for 9 years since I started college, that is. And one of those things that I kind of find continuously is that you have to have thick skin, but more importantly, you have to be willing to continue to deal with a lot of the, for lack of a better term, BS that kind of comes with being a person who is underrepresented and being somebody who is challenging the status quo. while also still being able to fit into those very traditional, very restrictive boundaries and parameters that academia, but also other systems that are inherently oppressive and discriminatory have put in place for us. So it's a lot about being tough. It's a lot about being willing and able to still smile while also still saying something that is sharp and also tells them that, hey, like, I'm not agreeing with what you say, regardless of how you put it. I don't care if this is the status quo, but I'm able to still be here. My value is still valid. I'm still talented. I'm still able to do these things, and try and fight off that nervousness, what is the term? You guys know the term when you're a PhD student, but you don't believe in yourself?
Imposter syndrome.
Imposter syndrome, and the ability to fight off that imposter syndrome. All of those things are very difficult, and it always is really valuable to have cohort members or to have family or friends and co-workers who are able and willing to kind of keep pushing you along and not letting you settle. Those are the things that I think have been able to kind of push me to still combat these oppressive things, and what continuously allows me to be motivated. Sorry, that was long-winded, but
that was great.
Thank you for sharing that.
Yeah, we had two questions that were sort of about the same thing. So Ans, you spoke about how public health is an inherently political field, and also about how academia teaches obedience and conformity. Do you have any thoughts about how academia can support you know, a different approach when a lot of the, you know, incentives for being a successful academic may not align with things like communicating to the public, studying marginalized groups, and, you know, and taking on political issues?
I think it's a structural issue, right? Like, and this is something like Dr. Zota was talking about earlier, that some of the things that I wrote after this blog, one of those was actually questioning academic structures. And I'm happy to share that with the attendees if they so desire. But the idea there really is that, you know, anytime these academic institutions are going to go out and they're going to say that, like, you know, Black Lives Matter, right? This is something, it's a hip and cool and popular thing now. You can go back just last year and all of a sudden it would have made people very, very uncomfortable just saying that thing, right? Like, you know, people probably got some critique that, oh, it's too political. It's like social activism. It has nothing to do with academia. So stick to that. So, but going back to the question of sort of like, you know, how can we approach it? Just teach political economy, you know, like we teach a lot of other stuff, teach political economy. And that's something that's also to say that, you know, for the attendees or to whom it may concern, one of my concern is and has been about this current moment that we are in right now. There's a lot of sort of like, you know, folks are finding out for the first time that maybe, just maybe, we don't live in a post-racial society, right? But the issue is that they're treating the symptom as the root cause, which is the current administration. I have no issue saying that. But the reality there really is that a lot of these structures predate that, right? So if and when your color is in power, don't get complicit and complacent at the particular point. You know, these systems have been maintained for a very long time in the name of practicality, in the name of compromise, and so on, you know. And we all contributed to it because we were quiet at the particular point. And all of a sudden, if someone else is in power and they're perpetuating those systems and people are up in arms about it. So once this moment has passed, still be critical about the particular thing, you know. And again, like folks who are very well educated, you know, with PhDs and whatnot, you got your PhD and now you know how that one cell impacts that one part of the lung, and that's the extent of it, you know. So this is to say, going back to that humility part, that reach out to other people, interdisciplinary research, multidisciplinary research, and more importantly, start with the communities, you know. CBPR is one of those things, like, you know, again, another a buzzword that people throw around all the time, but it really starts with asking the communities, what is it that they need? And then taking it from there, versus now I have this fancy grant, and if I throw a community in it, I'm gonna get additional 10 points. There's a difference between the two. People may not call you up on it out of courtesy, Well, we know, we observe it. So just that is all to say that, like, be very critical about any of these structures, regardless of your political ideologies and so on, because most of them have been in place for centuries. They're not new. So a lot of people who are active now in environmental justice, they think all this started in 2016. And 2016 was just someone turning on the light. It has always been America, and these systems have always been around. It's just like, y'all have been seeing these for the first time. So.
Great, thank you. One last question. We're over the hour, so we need to wrap up. But Mizon, could you speak a little bit about just being a student in public health? We have some students in the audience, and how they can kind of understand their education, how they can get through feeling like an imposter in the system, and how can they advocate for themselves?
Yeah, I think this is a question for all the panelists, but I could speak briefly. It's hard. I think just recognize that imposter syndrome exists coming in, and equipping yourself. There's also a lot of gaslighting, right? You're like, I'm really interested in this. This is where the community I come from. This is what I want to study, and then you don't see any of your passions or interests reflected in the majority of the faculty research. That's really disheartening and difficult. And then that the road to create your own research or curriculum is harder, right? Because you have to like pool resources and convince people that they should support you. I think as a student, so what was helpful for me is I started taking classes outside of my discipline. I started taking classes at the School of Design, the sociology department, trying to think about health disparities, but from a different discipline, not just public health. And really one class, the professor kept Lily's song. She was like, what are the blind spots? The class was about community development, and like, what are the blind spots in this research and what you're asking? What are your assumptions? And I think that, being able to question your research and question where you are and question what people tell you as truth is really empowering, I think, to be able to do that. And as a student, like, that's what you're there in school for, to ask questions and to challenge the status quo. Someone else also told me, like, you're not in school to be a clone of someone that already exists, right? Like, you should challenge and go for what is it that interests you and be your own person. That's like your time to train yourself. And I think really talking to other students and sharing struggles helps to validate, like, okay, I'm not alone in this. And I think what I missed in academia, I found by going to community meetings in Dorchester, seeing that public health action in person, in practice, and just being there as a resident. I didn't come in as a PhD candidate, and just listening, learning, and connecting with residents in my neighborhood. And really the first thing that I really helped with was with Vietnamese translation. And that's something I didn't need a PhD for, right? To help with, so you have a lot of gifts and abilities that is not related to your credentials, and really feel empowered that you contribute in multiple ways, right? You can be political and call your senators to pass this and that bill in your local community. You don't need to have a PhD for that. So I think just really connecting with others and really feeling like you're not alone is important. And if you can't find that support in school, then find it in your community, in your classmates, in your family, because really, education should not be a solitary process.
Great, thank you so much. Dr. Zota, do you have any last words to wrap us up?
I just want to say thank you. Thank you to El'gin, Brenda, Ans, Mizong for joining us, for sharing your voices. I hope this is just the beginning of a long career of you continuing to share your such important novel ideas. Thank you, Karen and Hannah and the rest of Che for hosting these conversations, and also for our audience members for checking it out, and also to thank you to EHN, who's not on the call, Environmental Health News, because they're a key part of this partnership.
Great, thank you so much. Okay, Hannah, I'll hand it over to you.
Great, and I just want to let everyone know that all of those Twitter handles and a lot of the links that were shared by the speakers today are also on our website at environmentalhealth.org, and I'll share that again with you in a minute. But thanks for everything, everyone. And thank you, Karen. We're approaching the end of today's webinar. A video recording will be available on Che's website soon, and tomorrow you'll receive an email containing a link to the video. The next Che EDC Strategies Partnership webinar will take place tomorrow, October 14th. It will feature Dr. Ali Cohen and Dr. Fred Van Saal and their new book, Non-Toxic Guide to Living Healthy in a Chemical World. To learn more and RSVP, please visit our website at healthandenvironment.org. If you are new to Che and would like to stay updated about upcoming events or more, please sign up to receive a newsletter by selecting the Join Us tab at the top of any page on our website at healthandenvironment.org. Additionally, if you appreciate these Che Partnership webinars bringing you the latest environmental health research for free, we encourage you to support Che's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers, Dr. Zota, El'gin Avila, Dzung Chu, Dr. Ans Irfan, and Brenda Trejo for taking time to present today. And to Karen, thank you for your excellent moderation. Thank you so much for joining us. Have a great day. Stay well and healthy.